disproportionately affected. So this meeting is an opportunity for us to collectively ensure that our decisions safeguard life-saving services. And of course, we will uphold that reprioritization must not come at the expense of essential community-led efforts. Kindly mute where in case you're not speaking so that we can have an orderly meeting. So your insights should we are grounded both in technical experts and lived experience, especially in the countries, will be quite indispensable as we try to see exactly, I mean, this particular second session. The first session we had where we were just getting the experiences in the countries, and then, of course, from those particular experiences, it was noted that, of course, people needed really to understand more about the budgets. So we are discussing about the budgets here, and what would happen is that Alana will take you through a comprehensive budget analysis that we have been able to do, just to give you an example. And maybe from there you can basically be able to know how to just do some few scenario plannings in your own countries. So what happens is that we need exactly to ensure that, of course, also this particular reprioritization is done in a way to ensure that we do not lose the community priorities. So I will not continue speaking very, very much indeed, but put put any question you have in the chat. Feel free, and of course also your names and where you're coming from in the chat also, and any suggestions as we continue with this particular meeting. And then, of course, we will also invite you to a vibrant discussion after the presentation. So welcome, Alana.
Hi, good afternoon, colleagues, and thank you, Dr. Muko. I think let me just begin by sharing my screen. Okay, so as I think most people know, the Global Fund, because there have been some concerns about whether the donor pledges will come in, there have been challenges with finances, and so because of this, the Global Fund has first of all did a slowdown of activities, which started back in April, and then now is doing a period of cutting budgets from grants that have already been approved, just to make sure that there's enough funding to last until the replenishment at the end of the year, and to make sure that we can start grant cycle 8 without financial challenges. And so what's happening right now is that on last Monday, each country received the revised funding envelope. So this means the new amount for the grants, so lower amounts for each grant. This was communicated to the CCM. Everyone in the CCM should have received this notification last Monday. And so what's happening right now is we're starting the second week of discussion at the CCM about the revised funding envelopes. And so the countries, the CCMs, have one more week to tell the Global Fund if they agree with the revised country and grant level amounts, or if they want to propose changes. And then each country will start going into grant revisions, where the final budgets, the final documents and everything will be finalized in September. And so that means that right now we're right in the middle of this important period. So let me go ahead and share something else. So just to say, and then for countries that only have one grant, the grant revision process will begin immediately. But otherwise there will be a discussion now. And if you have, sorry, let me just share something else. Apologies, let me find them. Okay. So if you go to the Global Fund's website now, you can see the amounts that the Global Fund has communicated to every country. So you can go to the bottom of the page here. We'll share the link. There's some documents here. So this is, if you look at this document, GC7 reduced allocations, you can open this and see the amounts that each country has been reduced. And we're also tracking over here. We have the list of each country and the amount that has been that their current grant amount, and then the new amount that has been communicated, and then how much that cut is, and what the percent cut is per country. And so if you have not received that letter, you can look here and see the amount that has been cut in each country. And we've also shared um, the documents that each country has received, and so you can look through and see the actual letter that went to each country. So you can see the current grant amount and then the new grant indicative grant amount for each country. So what does this mean for you? This is a very important time to be engaging with the CCM. This is the time to be understanding what the proposed cuts are, and then to be advocating for certain activities not to be cut. And so what we wanted to talk about today was that if you go to the GC7 reprioritization page, there's a document that's called the GC7 Programmatic Reprioritization Approach document. It's available in English and Spanish, French, and Portuguese. And let me show you what this looks like. Okay, so this is the Global Fund's guidance about how to cut activities in the grants, and this is not it's not rules, it's guidance, and so the countries are able to make decisions different than what's in here. But this is a really important advocacy tool because you can use Global Fund's own language when advocating to keep key priorities. And so I would suggest that everyone have a look in here. There's some high-level things that Global Fund has said. In particular, they said that key interventions to reduce equity, human rights, and gender-related barriers should be prioritized to make sure that all populations can access HIV, TB, and malaria services. Um, it's not enough to just, provide medications. You have to make sure that the interventions are designed to make sure that all key vulnerable and underserved populations can access them. The Global Fund has said you must maintain and strengthen community systems as a key priority. This must include community peer cadres, community-led service delivery mechanisms, and so on. So this is very clear from the Global Fund. Um, and they've said that if services are going to be integrated into primary care, there must be activities to make sure they're accessible and acceptable to all populations. Community-led monitoring is said that it must be continued to be prioritized. So these are some high-level priorities, but I think the most important thing to do right now is if you scroll down, there's this very detailed list that's here. And so when you're just engaging with the CCM and you hear, for example, that certain activities are proposed to be cut, it's very important to look at this document to go back and see what Global Fund has said. And so as an example, let's say if there's guidance that says that they're going to cut all the testing facility-based and testing programs for key
Alana,
populations.
there is a request
Yeah,
that you go up slowly.
okay, that's fine.
Mm.
Um, So if, for example, as you're engaging with the CCM, you might hear that there is a proposal to cut an HIV testing. So for example, they say that they want to cut the key populations focused facility testing. And so then you can look in this document and find that activity. And you can see the Global Fund has specifically said that testing for key populations should be prioritized, should not be cut. And so then you can bring that back to the CCM and say, the Global Fund has said this activity should be prioritized, so we don't agree. We would like to keep this activity. And the same thing for there's activities for, for example, condom and lubricant programming. It says male condoms and lubricants should be prioritized. PrEP programming should be prioritized for those currently using PrEP. And there's a lot of detail in here. And so to me, what I think the good approach, one approach could be, and we've done this in a few places. Let me share. So I think one thing that is good is once you're engaging in this discussion is first of all to understand which activities are in the grants. And so this is an online platform that you can go to understand which activities are currently funded. So this is an example from Uganda, and you could see, you know, in the HIV grant, for example, which activities are included in there. You can look at, you know, treatment, testing, prevention, and so on, and understand the budgets that are currently in there, just to get a sense of what's already approved. And then what we've been doing in a few places is to pull out each of the activities that are a priority to communities, understanding the budget amounts that are in there, and then using the language from Global Fund that says this activity should be preserved, this activity should not be cut. And so taken all together, I think the approach is to, first of all, understand what the Global Fund has proposed to cut, to understand which activities are currently in the grants, and then to use this document from Global Fund to be able to make messages and say, based on Global Fund guidance, this activity should not be cut. I think is the strategy right now. So let me share the link to all these documents with everyone. And maybe we could stop to hear some feedback from people about how things are going. And let me also open, I don't know if Lizzie wanted to add or Dr. Notbo.
Yes, welcome.
Sorry, Muko.
Yeah, welcome. Of course, I'll pass on to Liz, my colleague, to take us through the next discussion moment. Thank you. Welcome, Liz.
Great. Thank you, Muko. Thanks, Alana, for that. Well, for me, I'll just like to reiterate what Alana has mentioned, that if there's anything that feels like you do not understand, because there's a lot of information coming in and we expect a lot of information from the Global Fund on this whole process, just like the way Alana has mentioned. So just feel free to reach out. We have a huge team that could be able to help you break down what looks like, it's not understandable yet. For us, we're trying to, as the Learning Hub and the ENA, so we're also trying to make sure that any information that's coming from the Global Fund is community and CSO friendly. So we will try as much as possible to break down what looks like a lot of jargon and a lot of technical information from the GF. So do feel free. I know my colleague is here on the call, Grace, who's running the Learning Hub. And we'll share our email addresses, of course. Just feel free if you're within the Anglophone and Lusophone region. We're more than happy to even have one-on-one discussions. There's a lot of information coming in. There are a lot of data also, the way Alana shared, that could also help you figure out where, the CCM is, where your PR is at. But we're also trying to make sure that there's no information that gets to your PR and the CCM and doesn't get to civil society and community groups. So yeah, we'll continue having this discussion as we go. Thank you, Muku, for that. I'll just stop there. But of course, we'll keep on chiming in as we go on with the discussion. So over to you, Muku.
Thank you, Lizzie. So we'll continue with discussions, and I can see a few hands already. Maybe we can take the first set of three, and then we can please. We have a lot of experts inside this call, so feel free also to come in. It's not necessarily that we are the only ones here, but of course there is quite a number. So feel free, because this is our call. It's our community call. It's a community conversation, trying to educate each other. So, and of course, as Liz said, there is ENASO on one hand, which is basically the Learning Hub. There is also the Compass, the technical assistance, there is also data etc. There is change, many change partners are here. So please, let's basically have this discussion. So we'll start with Christine Yahama, and then after we'll go to HREP Malawi. Welcome, Christine.
Thank you, Muko, and thank you for the presentation that they've shared with us. First of all, I'd like to say I applaud our Vice Chair, that is Maureen Morega, for the good work that she's doing as a CCM representative in Kenya. She's keeping us informed of what is going on. But now, looking at the presentation that you've shared, my concern is on the integration into primary health care. My concern is, will there be something like standard of operation? Because it will be really challenging. Over to you. Thank you.
Thank you. That's one. And then we can go to Christine. Welcome, Tina. Christine, I know you're trying to unmute. No, Christine, you had spoken. Okay. All right.
Okay.
The HREP. Oh, it's Maziko. Welcome, Maziko.
Yes, Muko, thank you so much. Thank you so much for organizing this important conversation. As you're aware that the 1 year grant just finished the last June. And currently, I think in most countries, including here in Malawi, people are discussing on the reprogramming. My question, looking at the presentation from Lindsay, but also Alana, what I'm getting, which I just want to get confirmation from you colleagues, all the letters, when you look at them, they're addressing to government, and that's the Minister of Health in terms of reprogramming. And what the Global Fund is saying is that country need to decide. So as you know, countries were at different levels of engagement between the CCMs, the civil society, and implementers and government, and are looking at this current reprogramming, which is different from the programming which we used to have before because of the cuts. And I've been arguing in the recent conversation here in Malawi that we need to use mechanisms which can justify why cuts need to take or not. Because I look at the budget for communities and civil society to be very minimal in terms of percentage. I would have wished there are no cuts. But if you look at the guidance from the GGF, what they're saying that the country has to make a decision. So I just want to be guided, looking at the reference points which you have mentioned in your presentation that have to be guided by the Global Fund. But the same Global Fund is also saying that this is a country decision. It means countries need to make a decision. So I just want to say, how do we approach? Because the process of reprogramming, reprioritization has started. And as also you know that civil society in country where you have other civil societies who are implementing the grant, so there are others who are SRs who are not implementing. So in those circumstances, sometimes also you find problems in terms of how do we push an agenda, because we have two streams of different interest groups. What could you advise so that we have a win-win for civil society, looking that their budget is very minimal, looking in the overall grant? Thank you.
Thanks very much, Maziko. And then we go to James. James, let me see if there's any other hand. And then after that, we will go to the responses. Thank you. Welcome, James. Karibu sana, James.
Thank you very much. Good afternoon, all of you. I want us to look at this from a different angle. As we are suggesting and moving forward, the fact that it has been thrown back to the country means a lot. And the fact that they gave guidelines, means that they are giving us the way. So we need to be very careful with what they were saying, and where they have specifically shown where they are cutting the funding from. And I think basically they are trying to tell you, hey, hello, look more at the issue of commodity and service, not others. So I think it's a very dicey thing. So as we are debating, we need to look into it.
Thank you very much, Kamau. Now we'll, from those particular three presentations, the first one here is about integration, which is really a big issue in many of our countries. And the second is, we have received the new budget cuts, and of course, everything else is left to country competencies. So I don't know, Alana, you're welcome to comment on that. And of course, there is also Maureen, who is here, who is really a big expert, and any others. I don't know if Amanda and the rest of the team are in. You feel free to come in, and also Asia. So please come in, Alana.
I mean, I can start on the integration question. And to me, I think there are two things to say. One is when you're discussing integration, I think it's important to think about what should be what should be integrated into government. And I think there's some activities that are very, very well suited to be integrated into government. So for example, a lot of laboratories, human resources for health, public health facility based services, things like this that makes sense, supply chain for government to integrate into the Ministry of Health, into the public health system. I think the challenge comes when we hear that governments are very, very keen to take over community programs. And so if that's happening, I think the risks are that governments are not set up to contract community organizations and communities to do those kinds of programs. And so I think, to me, having some red lines that say, if integration is going to happen, is the government ready in this timeline by September to subcontract to community organizations to continue delivering these services? And Global Fund has been very clear that integration can't just mean taking community programs and telling everyone to go to the public health facilities, because we know that is not acceptable. That's not how people need to access services. And so I think pushing for it's important for government to fund and take over some activities, but being very clear about which things it's important for Global Fund to continue funding as a separate funding stream, and to have very clear red lines to say, if government takes over, we want some proof that it will happen, and we have red lines about how it should happen. So it needs to be community organizations, it needs to be key population friendly service delivery, and so on. So I think those are some thoughts on integration.
Thank you. On the second question, about different levels of engagement, and of course the fact that the Global Fund has left everything to for countries to decide. Would you also be able to address that? And of course, also adding the concern from Kamau on the fact that this will only mean that it will now be commodities and services. Alana?
Lizzie, if you wanted to add about engaging in country ownership or others.
Yeah, I could pick that
Yes.
one up.
Thank you, Liz.
No worries. So ideally, we knew this was going to happen. At the beginning, we were already told that the PRs were going to make the final decision on whatever they feel is relevant, and how reprioritization is going to look in terms of the countries. But for us, we're trying to say, despite that amount of power that they've been given, it's time for civil societies and community groups to start using the relations they've built, not only with their CCM, but also with the PRs. So we don't want to look at it from a tug of war sort of angle, but we want to look at it from, communities and citizens benefiting at the end of the day. So we're also pushing for, having more of a friendly discussion. It's reprioritization, it's less amount. That means there's a decision that needs to be made. How we get to that decision on what we feel like as a country needs to be given top priority means that, civil society, CCM representatives and the PRs need to actually agree on a lot of things. It does take a lot of time and effort to agree on what needs to be stopped, paused, or how reprioritization is going to look like. So we're saying just be in the decision-making tables. We're not going to agree, of course, on a lot of things because we don't have the money, but these decisions have to be made. And I know with Global Fund, from where they're seated, ideally, they did anticipate that this kind of tug of war was going to happen. And that's why your PR or your country representatives are the ones that are going to, give the final say. So for communities who are here, for CCM representatives, let's not look at it from that aspect where we're trying to push an agenda, but let's be a little bit realistic what that kind of agenda is going to be. But we're also saying if you feel like you're being left out and a lot of decisions are being made without the CCM being involved or civil society is being consulted, please feel free to let us know, because the Global Fund also wants to know whether there's, somebody's jumping a step or something. So ideally for them, there has to be deliberation and discussions before any sort of decision is being made. And we want to see that sort of transparency happen. So if that is not happening in your country, please feel free, as Muko said, there's a lot of expertise here and we have direct contact with the Global Fund, and they're also waiting to see whether we can report such kind of issues. So engage your CCM and let the CCM also, share more information. I know there's a lot of data that will go directly to the PRs or to the CCM. So let them also share this kind of information with you. Yeah, I'll stop at that, Muko, unless I've seen Grace here. I don't know, Grace, whether you'd want to chime in, but yeah, that should be good.
Thank you. I will bring Grace after Asia. Please, Asia, come in. And Grace, I will put you on the spot. Thank you.
Thanks,
Okay.
Richard. I mean, I think the question about country ownership and tone really depends on the country. I think in some country cases, there'll be much more willingness of PRs to be open and transparent. But what I'm concerned about is the fact that we are already seeing lack of transparency and poor engagement. So I think we need to face that reality. I think the cuts that are being proposed could have been much more severe. And I am very worried that because they are less large than expected, in some ways that might make community programming even more tempting to cut, because in many cases, they are smaller programs and they have not started yet. They're still under negotiation. So that's speculation on my part, but I think that's a very real concern. I'll give you a concrete example. We know in one country, PRs have been briefing civil society about what they think should be prioritized, and what should be maybe considered for a cut. And some of the language is pretty promising. In this case, it's a civil society PR. It's a second PR. But what the PR has refused to share is the proposed budget. So there's lots that can be put forward in a narrative, as we know, about protecting a specific area of work. But the budget is what really matters the most, because that's what communicates actually what activity a PR will not proceed with or will cut. And that isn't being shared. That's unacceptable. What they'll say, I bet, is, it's in draft form, it's a work in progress, but these are in some ways, the most sensitive documents. And just like communities experience during grant making and grant negotiation, often the budgets don't get shared. And so we get told one thing, but then the important program doesn't even get included in the funding request or in the final grant. So I fear that we might be in the same sort of rhythm and approach. And I think if that is happening to you, you need to escalate to Geneva really quickly. And if it helps to use other comrades with capacity, like any of us on the call, please do. But if you're not hearing what activities are being proposed for cuts, then that is a problem. And again, some of these grants are quite large. The cuts being proposed are 10 to 11%. It is probably the case that cuts can be found with, in lower impact areas without affecting high impact community programs. Of course, there's going to be exceptions to that. In some cases, maybe a community program really isn't performing very well, and or had some challenges or isn't really relevant anymore. Now, all of this is dependent on communities being able to unpack and understand what the status of grant implementation is, what's in the GC7 grant as well, and what's really not being implemented yet, like where there is delay and why. So that's a lot to metabolize and digest. If that's not already available. For many it is, because you're already part of CCMs and already part of implementation and leadership, but for others, maybe less so. So Lana shared a bunch of resources about getting up to speed about what GC7 is funding in your country. But if any support around that is needed as well, please let us know. These decisions are happening now. I also don't know if people, the deadline for that is about 1 week away for offering changes to the proposed cuts and how they're distributed across multiple awards in our country for different disease areas. Is there anyone on the call that's preparing to, where a CCM is working to change this? Because at least one CCM meeting has to happen between when the letter was received on the 30th and the deadline. Has anyone had any experience with that, or has anyone been able to actually receive country budgets that propose which activities will be cut and by how much? Thank you.
Thank you, Asia. Yeah, that we would like exactly also in case some of you are able, when you're raising hands, or in case you can also be able to respond to that question, in case you have received information on the budget cuts, any information. Then I will invite Fadi, and then after that we'll go to the chat. Welcome, Fadi.
Thank you so much. And PAD is my institution I serve is Fisher Forka Health and Development Initiative in Uganda,
Right.
and my name is Simon Ayebale. So I'm happy to join this discussion. It's quite really highlighting key issues, but in Uganda, I want to update you that community is well involved through the coordinating mechanisms of our disease constituencies. We are participating well in the discussions, but I would like this meeting maybe to highlight more as really the funds are dwindling, and our most best country in the global fund was US, we all know, and we have a fear that they may not commit all. But I think this wouldn't be the end of the road. MAP, we are looking at ending HIV as a public health threat by 2030 globally. We need to have some rescuing situations as we are trying also to contribute more on generating local resources. And I would like also to have a strategy at a global level. Which other friends can we reach to bridge this gap? Because the conversation should not just stop at reprioritizing, having no funds. Our goal will not be achieved, and we really don't feel okay. Our people to miss treatment in facilities. we need to continue to find other avenues. And I would like to see at a global level pushing a strategy to beef up this funding gap. And we take it as a whole, looking at our assemblies, world level, the United Nations, the African Union, up to the regional level. I think that will also bring a good mechanism to sustain our interventions. And finally, what I want to contribute is about changing, maybe replanning most of the activities. There are those activities which are not directly contributing, but they are in the long run process. When you look at issues of human rights, stigma and discrimination, actually we still need to maintain some of these interventions. In the long run, if we can eliminate most of these community activities, you find that people may not adhere and we may not achieve the zero infections by 2030. I submit. Thank you.
Thank you, Ayabale. Yeah, yes. I will basically go through what Ayabale has put through, and then of course also a bit of what Anguva has basically put in, and Magdalene, and then please, in case we respond to this before we come to the next set of people who would like to ask for some information here and there. So here, Stephen is mainly requesting, if at all, let's say there's any information on how we can be able to engage the communities, and also offering some recommendation here, maybe even maybe if at all, let's say an option like the virtual participation can be considered. It seems that, of course, maybe Stephen might be coming from a place whereby, of course, maybe there's some darkness somewhere, and there is, communities are wondering exactly what is happening, because during the Global Fund process, you have a really wider consultation process. So, and Magdalene, okay, I think there is Tiwonge, who is, what is needed is the capacity of members to be aware of the Global Fund processes and how funding requests and cycles. Even now, I'm aware of the funding. Even now, I'm not aware of the funding priorities. I think that is, I think there is something there. So I would leave maybe Asia, Maureen, and in case you are responding to that, and then we can also move on. Welcome Asia, and then Maureen.
Mine was not a response to those points, but maybe I know there were very limited resources made available somehow through some TA providers. I'm totally unaware about how much and which ones, so perhaps someone else has that information to speak to Simon's point. I wanted to come in quickly before Maureen, just about one other point about the integration discussions that Alana mentioned. I think it's very important also. I think the tendency for many of our governments is to point out that integration is the solution to these challenges, that indeed government can carry out service delivery in a much cheaper way. I think there's a very big concern that what we're witnessing right now is a big experiment and integration, and it is going catastrophically poorly. That's in part because there's no planning. It happened in a malicious way by the US government, but nevertheless, what we're seeing is that integration requires additional resources to overburdened, underfunded health systems. And that's speaking broadly for the general population, it is a million times more true for much more vulnerable populations, whether criminalized key populations or adolescent girls and young women and pediatrics. So the last point is, as a tool for your deliberations, make your way to the CCM table, get into the meetings that are happening with PRs, raise these concerns, ask, where is the budget? What activities are being proposed for cuts? Don't just say, what is being protected, because it's easy to talk about that. Make them say, then what is being proposed on the cut list, and make them put that up on a slide. And then the final observation is that, for example, the Clinton Health Access Initiative, CHI, just put out what they're calling a market impact memo. It's basically a memo that is beginning to show the effects of this radical malicious integration on service delivery and service uptake. And we see already thousands of kids exposed to or living with HIV have been lost to follow-up. Numbers of viral load tests and CD4 tests and HIV tests have been have dropped. So monitoring and tracking is going down. And then all of the community led loss to follow-up prevention work is evaporating, at least in the countries that were polled, because of what's happening. So I think that's a way to say, look, we can't just say integration is going to fix this problem. If integration is going to happen, there has to be a plan. It has to be transparent. It has to be accountable. There have to be indicators. You can't just say, give us the resources, we'll work it out, because what will happen is people will be pushed out of care. And then in addition, standalone, unintegratable interventions have to be maintained. For example, drop-in centers, targeting key populations, even if they're more expensive. There are seriously ways to make them less expensive, for sure. But to say that they can all be integrated is extremely dangerous. Thanks. Just wanted to make that point about what might be likely a dynamic that we're seeing around general population and key population integration deliberations at the country level.
Thank you, Asia. And in case you have the CHI impact memo with you, kindly post it here so that people can be able to access that. Maureen, please come in. And as you come in, there is this particular question. People have asked exactly what is the future of Global Fund with the drawing of USG, and what are the new avenues? Yes. Welcome, Maureen.
Thanks, Richard. So this is Maureen Luba. I'm not sure if I'm the right person to respond to that question, but
Sorry,
I think I would just share. No, it was not Maureen Luba, yeah. But I would just, yeah, I mean, I would just quickly share a few reflections, my 2 cents. I think totally agree with the emphasis that Asia is putting when you go into those CCM demanding for the budgets and for the details. I think to James, I think it was James, I think who was, I think raised concern around like what gets to be prioritized, that in the end it's going to be biomedical. I think for me, ideally, the engagement of influencing this process should have started with influencing what goes into that document which Global Fund shared, like what interventions gets to be prioritized. But my assumption is that maybe through our representation in the Global Fund board, but also through the committee delegation, we're able to influence, because that's where the beginning point, what Global Fund says should be prioritized, because we have to make sure that what Global Fund says should be prioritized should indeed reflect the reality on the ground. So I'm assuming that, you know, there was a way in which committee were able to input into that, because that's the starting point. I think there's so much that CSOs can achieve when they speak in one voice, with one voice. And I think to a very point that Masiko raised, we know that we have different groups of CSOs, people that are coming onto the table, maybe with different interests from different points of view. But I think by the end of the day, we are all one. Even the SRs, whether you're an SSR, you're SR, you are implementing on behalf of the communities. You're implementing on the behalf of constituencies. Global Fund who did have, provided the resources to everyone. So they had to select a few to represent everyone. So I think it's important that we speak with one voice. We are there to support one another, because by the end of the day, we want to make sure that what gets prioritized really addresses the needs of the people on the ground. So I think if there's a way that countries, as we're working through this, if we can find ways in which we can speak with one voice, I think there's so much that we can achieve rather than going into those meetings divided views. I think important to also acknowledge that when the initial communications were sent to countries, of course, different assumptions on how much was going to be cut. I think what we are seeing that in other countries, governments and players had already gone through a deprioritization process. So they had gone through this process, of course, with different assumptions, right, in terms of how much should be cut. So now I think thanks to the push from all of you, I think we are seeing this global fund pushing for more community engagement. But again, it's important to acknowledge that we're not going in those meetings on the same foot. Our colleagues already have their joker, their cards in the they already have done their prioritization process. So I think it's really important to be careful not to end up in a situation where but you're just endorsing what they had already done in their corner when we are not there. So I think that's why the point, that Asia is saying, knowing what are the budgets, what are the amounts, what was the the assumptions or the factors that were considered in coming up with those prioritization, those budgets. I think it's really important. Otherwise, we may just end up going into those meetings endorsing, something that I already started. It's something that he had already done when we're not there in their corner. So I think it's important for us to be mindful of that. And I think pretty much important to that point, in relation to that point, is to make sure that we are going in those meetings there. So I think that's why I really appreciate these meetings. The documents that have been shared, the budgets. I think thanks to the team that I worked on the budgets, the information. It's important that we know these budgets, we know this information, we know that the interventions that needs to be prioritized. Otherwise, we may end up, they have given us the space that we are there, but we may just end up, ticking the box. CSOs were engaged, committees were engaged, but then in the end, we're just there to endorse what they had already prioritized. I think for Malawi, Masiba, I think, and also coming into this. Yeah, I think the other point I wanted to say, we should care, much as we are here to defend community interventions, given the time, I think we should focus on that. But at the end of the day, I think we should also care more broadly, like what goes into the biomedical, because if we don't end up with not enough HIV test kits, for example, or with cuts, massive cuts around HIV prevention, because we are the beneficiaries of these services by the end of the day, then that's a problem. So much as we are defending the community interventions, but let's not also forget the broader picture, like what goes into the biomedical. Because I think I was looking at what the initial prioritization focused on at the very beginning. You could see some of the interventions, even biomedical interventions that were being cut, were really concerning, I think, with regards to sustaining the response. So I think for the CCM, I see Masibo is coming in, but just to say that I think there's a meeting on Friday. We did a few constituency consultation, pretty much rushed to say there was a workshop that we had last week, this Thursday. Thanks to Manaso, our coordinating body, they're trying to share information and bring us all together. We have a meeting on Thursday just to prepare for the broader CCM meeting, so that our representatives goes into that meeting well prepared. But again, I think Masibo can share more information. And to your question on the future of global fund, I'm not really sure. I think all of us, that's a question that's on our mind for all of us. But I think, yeah, it's really important, I think, for us to, critically think about that. What does that mean for each one of us in our context, knowing that we all have come from different countries with different capacities in terms of absorbing or addressing or filling in some of the gaps? What does that mean even for our respective countries, not just for Global Fund, for our respective countries as well? Sorry for taking up too much time, but I just wanted to share that. Over to you, Nico.
Thank you, Maureen. So I will only take two more contributions, and then we'll close, because we have we only have 4 minutes to time. And of course, I will ask the contributors to be as short as possible. We start with Sophie and then end with Maziko.
Thanks very much. My name is Sophie Domitis, and I'm the CFP for the Developing Country NGO delegation that sits on the board. Just to Maureen's point that she just mentioned about where was the starting point at the board, I think it's really important to note that at the last board meeting, there has never been so much alignment around the table And there were 4 points where almost every single delegation was clear about. The one was that we need to keep communities at the center of the Global Fund. The other one was that, there needed to be full engagement of the CCM, especially civil society and communities. The third was a real request for clear communications and that the Global Fund don't do more damage. And the last one was to clarify the definition on life-saving. So the 3 civil society and communities delegations pushed really, really hard on this to say that you need to be clear. So, I just wanted to say that we fought, and right now everyone needs to fight. And one piece of advice to add on to the calls for if things are not working is to be prepared to share what's not working in writing, because it's no longer enough to say we're not being included. Because if it comes to one of the board delegations, we will need more than, it's not working. That's not working anymore for us. So, and what was helpful is where it was clear that community programs were being decimated. They actually had it in writing where the FPM was saying, we're not doing that. And then that is something that the Global Fund can then act on. Over.
Thanks, Sophie. Thanks a lot. Maziko, please try as much as possible to summarize.
Thanks so much, Richard. I will not take more time because Maureen has spoken. Just to add what Maureen has mentioned, that yes, indeed, for Malawi, we have tried to engage within the civil society. But what I just want to emphasize what Maureen has mentioned is that some of the processes, because it's country-owned, it's government-owned, the PRs both or PRs, I think he had prior engagement to what was already being discussed. So it becomes problematic when maybe you are trying to bring more evidence, because the year has passed and I'm aware that most of the SRs have already implemented. Others maybe they've got a good absorption capacity. Others maybe they haven't done as much. So I thought maybe evidence will. So for me, is to urge our colleagues from there, as we are discussing, that when they're trying to make a final review of what has been proposed, I think basis should be based on evidence, but also what has been achieved so far within the year of the implementation. I think that's what would be key, other than maybe using the other processes which can disadvantage civil society. Because I already said the civil society budget, if you look, is very small and minimal. Over. Thank you.
Thank you very much. There was a question that somebody had asked that he did not understand the community. Let me see. This was the community, the community funding priorities. I do not know exactly if at all. Let's say, Alana, you can just display them very, very quickly, and then of course, after displaying them, we can basically end. But of course, what has been emphasized is one voice. And then, of course, the government had gone a lot of steps further. So in case things are not working again, as Sophia said, let's basically put it in writing and, of course, get it to the board. And, of course, she has provided also her email address there. So thank you very much indeed. And then next week, as we had agreed last week, we will be having this particular calls on a weekly basis. We will be meeting again to just follow up exactly what is working and what is not working in the countries. To you, Alana, and of course you can close after. Thank you.
Thank you, Dr. Muko. I don't have anything else to add.
It was just that particular question on the community. Let me see here. The community funding priorities that was asked by Tiwonge Gondwe. If you could just display that again, or maybe help him to know where to find that.
Yes, the I can reshare the links really quickly. We have, let me see. So most of the documents are now on the Global Fund website, and so you can find which activities should be prioritized, which should be, so let me share there. I think that has everything you need. You can see the cuts by country, and you can also see the operational guidance from Global Fund saying what should be preserved. And I've also included emails for everyone, so please reach out if you want more help going through that.
So thank you so much. Again, it's on a weekly basis. So we will also be meeting next week at a time like this. The link will be shared early in advance. Thank you. See you next week. And of course, engage with one voice. And in case there is any challenge, let's basically get some help. Okay, bye for now.
Bye-bye, thanks.